Out, I debrided the the granulation tissue and debrided the sockets with the waterlays, with the curette and the waterlays, and ready to make our assessment here on removal of anterior bone.
Let's get this guy down. So we got the mattress now, so let's put him on.
All right, Spencer, you are doing fabulous.
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 Just get in there with the little
Do you want
I might give him another knock on the house.
taping.
Because he's way too picky, so he's going to take it.
Going to the distal root is what I was planning on, yes.
Yeah, I think you're better off doing that.
Yeah, plus it gives us a little bit more spread though, because the next tooth is going to go into the the second bicuspid, so we'll get a little bit of a more of a AP spread there.
Can you describe what you're looking for?
I'm just making an assessment as to where the bone finishes and how much of the soft tissue we need to close around the implant that's available. What size are you putting back here, Chris?
Chris, what size implants?
We're planning on 4.75 fusion implants in there, which finishes out at the top at a 5.5.
Let's get a gown on
19 or
Sanjeev.
19, yes. Yeah.
mesial or
Sanjeev, how about a gown on for you, just if you're going to be working there?
I'm
Just
just going to measure. I'm going to let you do it. I just want to kind of get a
okay.
assessment. So Chris, here's one of the things you need to consider. How wide is the coronal portion of your implant?
5.5.
And your soft tissue is at about 7, so you got 1.5 millimeters to manage here.
Right. And that's where
And you're putting one here?
No. Yes, right. Not in the mesial root. In the next tooth forward, the second bicuspid.
This is the mesial.
Okay.
You're putting one here.
Yes.
What's the dimension here?
Yeah, 4.75 in that also, which is again a 5.5 across the top.
Okay. So you may want to consider splitting this right here, undermining that a bit. Get your PRF and your bone graft on the mesial that you're going to save the bone from the round jaws right here. Place it, hack it, undermine this, and then just release it so you can rotate that, because you're going to have 1.5 millimeters gap of soft tissue here, so you can rotate that towards the mesial. You can do the same here. Now the issues, 5 you said here? Chris?
Wasn't that the mesial root though? Isn't
No,
it?
the mesial root is right here. This is number 20.
Okay, yeah, 5 in there, 5.5 here. Yep. That looks like it's going to be.
That's going to be fine. I think you may have to undermine this a little bit here and here. And since you really don't have any side, then nothing's going in here, right?
No, we decided not to that because there's no buckle.
So why don't you release this with a, carefully release this a little bit and undermine it down past the MGJ and pull that up and also try to get a mesial sealed, so you get a fibrin sealed there. You have a higher lingual cortical plate here, about 2
Yeah,
millimeters.
that's a 22. And of course we were planning to take that down about 3 millimeters in that area.
How
That
deep
was
is
the
it?
original plan.
And your buccal plate is right there. So you only have about 1.5 millimeters of soft tissue here, Chris.
Right.
You're probably going to lose 1 millimeter of the bone there. And the depth of your... How much do you have on the CT scan? I don't remember. Past the apex.
Oh, yeah, there's plenty of bone. On the cuspid.
Yeah.
Oh yeah, plenty.
And he's got a pretty nice buccal plate, Chris, so...
Tooth with the folder. Is it on?
I think you're right, Chris.
Where's
Take down,
this,
I wouldn't take it down 3, take it down 2,
Call me an X-ray.
and then see where you're at. And then that may be enough. And again, you may have to undermine the knees. Definitely take this piece of bone out right here.
And the whole lingual too. The whole lingual's high there.
I think your limiting factor isn't, it's going to be the distal and the mesial and the buccal here. They're about the same height. This is your taller, only about 1.5 millimeters, 2 is all you need to take off here, Chris. I wouldn't go much more than that. And really, I wouldn't even take it out. Maybe you can, when you stretch that, that's going to... Yeah, I think you're going to be fine when you flex that. And you may have to release this a bit, Chris, right here, and then rotate that in and rotate to get a 5-inch seal there. Open a little bit, Spence.
Can you see okay?
Yep. You got lots of nice one. I would not break this here, Chris, but I would take
A little bit of the facial plate off there, just sort of, you know, round it off a little bit on the very facial line angle of that whole ridge there in the anterior. We were really planning to take that down.
well, if you take it down, you got to remember, that's going to determine the height of your implant on the canines and the mesials.
Right?
Okay, and so right now, if you just lay this perineal probe here, you have about 1 millimeter